Welcome to the Visibility Gap, the podcast where we explore the inequities that shape our healthcare world and uncover solutions that can drive real change. I'm Dr. Jen Ashton. Today we're diving into a topic that truly impacts everyone: mental health. Here is a startling fact. Women are twice as likely as men to experience depression and other mental health challenges, that according to the Mayo Clinic. Yet, the way men and women experience mental health and the care they receive can truly be worlds apart. In this episode, we'll examine how societal expectations, cognitive load, environmental stigmas, and systemic biases in healthcare create unique challenges for women. We'll also explore the barriers that make accessing quality mental health care even harder and how these hurdles impact women's overall well-being. This is a conversation about understanding, empathy, and, the best part, actionable solutions. We'll be joined by a panel of experts who will help us navigate the broader system and share insights on how organizations can prioritize mental health as a visible and vital issue. But first, let's start with a personal story. It's my pleasure to welcome Joy Allen. Thanks for being here.
Thank you. Thank you.
Why was it so important for you to get into the mental health awareness field?
So I am a childhood trauma survivor. And also recently I found out that I deal with mental health issues. For me, it's so personal.
First, it takes a lot of bravery to be vulnerable. So I really applaud everything you've done to get you to this point and what you continue to do. And you're not alone, right? I mean, it's 1 in 5 adults in this country deals with a mental health issue. Breaking that cycle of your past, I know, was very important to you in your commitment to mental wellness and in the day-to-day work that you do. You shared some of the problems or obstacles that you've had. What about on the opposite side? What things have you found positive, helpful, empowering? And maybe they're different, that maybe they were one way and now there is something else that you find helpful. But what has been really helpful for you?
What has been really helpful for me is telling myself I am enough. You have to do a lot of positive affirmations to yourself and setting goals and achieving them.
Have you ever heard the term speak to yourself as if you were speaking to yourself as a child? How would you speak to yourself in a kind parental way? You mentioned not feeling good enough, but you also said that there are times where you don't even believe you.
No.
So it's trust, confidence, faith, self-esteem, right? What's been helpful for that?
With faith, believing in something, knowing that there's a higher power that kept me here, that gives me strength, that, even when I think that I can't do something, it happens. Having people around you that support you and keeping those people around you and not pushing them away. If you isolate yourself, you don't have anybody else but yourself to tell you, to talk to you, to keep you in a dark place.
Do you think everyone's access now to social media helps or hurts a feeling of isolation or not being seen? Or for you, have there been times where you've found it helpful or not so helpful to have access and exposure to social media in terms of the issues you're dealing with or the way in which we talk to ourselves?
I mean, for someone dealing with mental health issues, social media can either be a blessing or a curse. Because if you're in social isolation and your only contact with the world or seeing anything outside of your own thoughts would be social media, which could be a blessing to someone who is alone, right? Because you do get to see, like we're doing now, you do get to see other people's stories and how they helped themselves or how other people helped them and how they got over trials and tribulations. But then on the other side of someone who has mental health issues, you're comparing yourself to other people. You're always seeing, because on social media, you're not always seeing the bad. Most of the time, people are highlighting the good things in their life, or even lying. So you don't know, like they say, comparison is a thief of joy. So I feel like social media could either be a blessing or a curse.
Do you feel that in general, from the community that you're in or your personal experiences, that employers and professional workplaces are doing a better job at destigmatizing mental health issues or enabling greater access or resources for people who want to or need to work on their mental health? Do you feel like it's improving?
For me, I feel like the improvement came in the capacity in which I'm working. Most of your time is spent with these people at work. We don't spend as much time at home with our loved ones. So for work, especially at the where I work, mental health is a big thing, and they support mental health. They offer us like the EAP days. We now have a wellness day that you can take when you need a day, an extra day outside of paid time off. We're having Zoom meetings about how can we improve, company morale. How can we do those things? I feel like it depends on what work setting you're in to when you have access to those resources. And in that aspect, like for me at work too, I have panic attacks at work. And
a lot of people do.
There's been multiple times I've had to be transported by ambulance, actually, because I just could not on my own calm down.
And now that you're in a management position,
yes,
have you had any experiences where the tables almost seem like they've turned and you're actually recognizing someone who's struggling? You're the first one to see it and you're the first one to notice it, and that you're able to actually reach out to that person and say, this is what I've noticed. I see you. I see what's going on. This is what I am seeing. This is what I'm observing. Do you need help? Do you want to talk? This is what worked for me. Have you had any experiences like that?
Yes. So being a leader and being a manager, part of that is you have to get to know your people. And I do pride myself in my staff being able to come and talk to me. So I think it's very important to get to know the people that you work with. That way you are able to notice those changes and those differences.
And letting someone know that they are not invisible. Speaking of letting someone know, you're a mom to a son,
yes.
18.
Yes.
I also have a son, so I know the pressure of raising any child, but I think there's something really unique and special about the relationship between a mother and her son.
Yes.
What kind of lessons are you trying to pass along to him?
Like right now, being here and knowing that he may see this and going for what he wants. He actually inspires me to go for what I want. He supports me. He's always worried about me because he sees me, my tears, my happiness, my accomplishments. And it's been us. Mm-hmm. It's been me and him. I was a young mother, teenage mother. I had him when I was 18. So we grew up together. And it's about like supporting each other and letting him know that he can always talk to me. And you can't fly until you take off. You'll never fly until you take off. So he supports me in that aspect, and I support him in that too.
I say all the time, as a medical doctor, we all the time need a checkup from the neck up. Right? And when you think of how many medical doctors who are not mental health professionals ask, how are you feeling? I feel like a lot of times we're really asking, how are you feeling physically? When it should be really, how are you feeling mentally and physically? Mm-hmm. And I know as a mom, there is no greater priority than walking the walk and talking the talk for our children and for ourselves. And they have to see us model the right behavior when it comes to our mental health and well-being so that it's not a surprise to them. I live by a mantra that if you want to heal, you have to feel. Because we all have pain, some of us more than others, some of us more trauma than others, but burying it prevents that recovery. So feeling it, letting it out, letting it be heard, letting it be seen is therapeutic.
Yes.
Joy, I just want to thank you for the strength and courage and humanity and realness that is so clearly wrapped up in everything you are and everything you do. It takes so much courage to be able to have these conversations and really use what you've been through, the bad and the good, to help others, is really what it's about. And I really admire it. So thank you so much for sharing your story.
Thank you, Jen.
And to help us process Joy's story and explore the overall cognitive load, trauma, as well as mental strain that women face on a daily basis, as well as what companies can do to bring this often unseen issue into the light, I am joined by two incredible and esteemed experts. Dr. Margaret Rutherford is a clinical psychologist with over 30 years' experience, specializing in treating individuals and couples for depression, anxiety, as well as relationship issues. She's the author of Perfectly Hidden Depression: How to Break Free from the Perfectionism That Masks Your Depression. Welcome, Margaret.
Thank you.
And Dr. Deirdre Cooper Owens is a historian. She's an award-winning author of the book Medical Bondage: Race, Gender, and the Origins of American Gynecology, and she's the Associate Professor of History at the University of Connecticut. Dr. Cooper Owens' groundbreaking work has shed light on the intersections of slavery, race, and reproductive medicine, offering crucial insights into how history shapes our present-day healthcare systems. Welcome, Dr. Cooper Owens.
Thank you for having me.
All right. You heard Joy's story.
Yeah.
It was powerful. It was raw. It was brave. One thing that I would like you to comment on is just how much she and women like her have to deal with on a day-to-day basis. You have the history, you have work, you have parenthood. It's a lot.
Yeah. What I was so struck by, and this may be a little bit tangential on my part, but I think it's important to the story. She was abused in some way. She did not share in which manner she was abused. But then she told and wasn't believed. And then she used the word, I almost felt punished. What people don't recognize is that when abuse, it's reprehensible that it happens. But at the same time, when it's not honored, when it's not seen, when it's not understood, when it's not believed, that damage makes everything go inward. And she's carried around this shame, this guilt, this sense of lack of worth. I mean, it is just, it is such a heavy burden to bear. And talk about how that then begins to impact how you as a present-day adult try to deal with mental strain, getting a job, when you've got these feelings of, if someone really knew me, they'd reject me.
I'm so glad you explained that for us, to how that cycle psychologically gets perpetuated and made worse just by not being seen, not being heard, not being believed.
The damage, I have been told by my patients, the damage is almost as great as the abuse itself.
What has history told us about repetitive trauma or breaking a cycle?
You know, so that's a wonderful question about what it's taught us. I think for me and so many folk who I engage with, it's about, and I'll use a kind of colloquium from the Black community, breaking generational curses, so to speak. What really stood out for me was when Joy mentioned how she was such a young mother, having her son at 18, so obviously pregnant at 17, and having to grow and learn with him. And as a college professor, you know, I often joke with my students, your brains are still growing. So I won't be angry with you for long because I know your brains are still growing, right? You still have a couple of years, you know, before the brain stops growing. But to, you know, to be serious, you know, here she is, this young woman who now has to do something that's probably the most incredible job in the world, which is to parent someone else while she's growing with him, right? Emotionally, psychologically, biologically even. And so It is so encouraging to know that she was intentional about how she was going to heal and plotting out that path. I'm sure it wasn't easy, but to be able to have those different steps is important. And so I think that's the way we can use history, as a field to be able to look at the blueprints that people have left for us to be able to follow and tweak and all of those things in between.
And I loved that she said, I can be afraid and I can be strong. Right. One does not obstruct the other, or they could be simultaneous. And
multiple truths.
Yes, multiple truths. And so that is such an important gift to give herself, to give her son, to give the people that she sees at work. I love that she said, and you pointed it out too, you see them.
It's a process that truly we should never stop working on ourselves, right? Some of us have more work to do than others. But as a woman, it's a lot.
It's a lot.
When you're talking about your job as a parent, your job, your job for yourself, you're responsible for others, you're responsible for yourself, you're responsible for your family, it can literally seem like you're always putting out fires.
Yeah.
And how important do you think it is to have role models in history or current times, present times, to be able to say, look, here's an example, like Joy, of someone who is doing it?
For me, I think the personal always is inspiring, I think, for others, because you can read their stories or hear their stories and kind of connect to a universal theme or truth. And so although joy might be housed in a certain kind of body, there's something that is universal about that story that I think men, women, children can pick up on and say, oh my gosh, this is so similar.
Right.
I think I can make it through. And like Joy, being able to know that you don't have to take a big bite. Even a nibble is enough towards your healing, right?
I want to talk about some statistics that I know are unfortunately well known to you, Margaret. 23% of American adults have a mental health issue. 1 in 5. In the teenage population, ages 10 to 19, 14% globally have a mental health related issue. Many in that population go unseen, unrecognized, undiagnosed, and therefore untreated. With these kind of numbers, what do you both feel needs to be done on a systemic level, but also as individuals? Because I think individuals can hear that and say, well, I don't have 10 years or longer to wait around for this to be fixed. So looking at it from both of those standpoints, what do you think can be done?
I think, for women, we have the annual women's wellness exam. I think there needs to be something that is akin to that in terms of emotional and psychological care, or at least care management. A part of what I do, and it might seem as if they're, not congruent, but as a reproductive justice advocate, the core component of that is access. And so if you can provide access to people in terms of their emotional, psychological, or psychiatric care, and you're doing that on a regular basis, that is so helpful, I think.
So, Margaret, 2 other statistics that really caught my attention. According to one survey, 83% of American workers experience work-related stress. We should note, not all stress is negative stress.
No.
Stress can be positive, but somehow I have a feeling this has to do with stress that is not positive. And we know that this has a direct consequence, obviously. Poor mental health or mental health-related issues have an impact directly on someone's professional life, productivity. Mental health-related work absences, according to one survey, have increased in the year 2023 by 33%. Speak directly to people in a work environment. What can they do? What can employers do? If you were in charge with rectifying this situation, what would be your first move?
I've been speaking to an industry, the construction industry, frequently, and they have an extremely high suicide rate. There is training out there that you can send your employees within your organization, within your corporation. It doesn't have to be a professional. It could be a peer. It could be a natural leader. And in this way, you can begin to develop more of an understanding of mental health.
Do you think that mental health care should be directed differently for women versus men?
I do. I have to say, I am looking, even though I have done reproductive justice for, almost 15 years, I study women and write about women, and but I am so scared, especially for our young men. The rates of suicide and depression,
Yes.
the turning to substances that are not healthy for them to escape, concerns me. COVID cut off the life expectancy by a year or two of Black men across the board. So, I just think about the ways that young boys and men have been socialized to suppress feelings, that it is creating a healthcare crisis that we don't want to speak about.
Do you think it's worse for Black men?
So, yes, but I am not sure if they're the only ones, right? But I do think that this crisis, although the numbers are always kind of greater for communities of color, when we look at, the rates of incarceration or, some of the pathologies and the ways that they've been data tracked. But I am also seeing an uptick in the number of suicides and the percentage of young white men and boys who are saying they are unhappy. And I just don't think we're getting at what that really means. And so there does need to be a focus on how do we best communicate and reach boys and girls, men and women.
Right. And we've talked about cellularly, men and women are different down to the cellular level. So the same illness, disease, depression, anxiety can, and in fact, oftentimes does manifest differently in men versus women. I was giving a talk recently to a group of 30 CEOs, and it was about mental health in the workplace and prioritizing our mental health and how much work we all have to do to bust stigmas and make it so there's no shame in that game. And one brave CEO actually shared that this person would find it difficult as CEO to step away from his position for a mental health related issue. And in that vulnerable, transparent disclosure, actually, I think had such a positive impact on those other 30 CEOs in the room, because everyone said, actually, I would too. And boy, if we're leading this company or this division or this organization and we can't talk the talk and walk the walk, we have a big problem. And so I think everyone needs to feel that sense of empowerment and have access to information and resources and education. But we need to have this also modeled by people in positions of responsibility and authority and leadership.
I totally agree. I mean, I just think that is so important, and Joy is a great example of that. That she has come forward today with her own story and seems to welcome the opportunity for people to know it, even though I'm sure it was hard sitting in this chair and talking to you. So I'm so glad that this is being done. That this kind of information is so pertinent to anybody.
Yeah, it's important. So the prescription that we've heard, I think, focus on the strategy, the process, step by step of taking steps to prioritize our mental health and well-being. No shame in the game. Drop the stigma. Community, service to others. Reach out to help others, but also accept help when offered to you, and start with the observation. I love just that non-judgmental I've seen that, or this is what I'm seeing. This has been so impactful in what you've both shared on so many different levels, in terms of what women go through and the cognitive load, but also just our mental health and well-being is truly important. So thank you so much.
Thank you.
And thank you to our listeners. We really hope this episode of The Visibility Gap has helped you and your loved ones feel seen and empowered. If you found it valuable, please don't forget to share it, like it, and subscribe to stay connected with us.